Good morning. Thank you for joining our chat in honor of World Breastfeeding Week. Today we're going to be chatting with Dr. Yetunde Awosemusi, thank you, and Dr. Shivani Patel. Dr. Patel is a maternal fetal medicine specialist here at UT Southwestern, and Awosemusi is an obstetrics and gynecology specialist. So we're really thrilled to have them here. As always, don't forget to like and share this with your friends. We have lots of questions out there about breastfeeding. We want to take as many as we can get to. Be sure not to ask really specific questions about your condition, because we need to keep it in generalities, but we'll answer as many as we can get to. So welcome, ladies. Thank you for joining us.
Thank you for having us.
I think, breastfeeding is definitely something that you hear a lot about. Lots of moms do it. It's been in the news a lot lately. I guess the basic question to start is, and maybe start with you, Dr. Patel, and then go around the circle. What are some benefits of breastfeeding?
So breastfeeding, when we talk about benefits, breastfeeding, we try to break it down into benefits to mom and to the infant. And the biggest thing I think these one to kind of go towards is the infant. And what are benefits that the infant has from breastfeeding? The first is that breastfeeding really is the most nutritious food for a newborn infant. And especially during those first 6 months of life, when the immune system of the infant is not as well developed, in those first couple of months when they're not getting vaccines, mom really supplies a lot of not just vitamins and minerals and fat, but also good antibodies that help protect that child from illnesses like diarrhea. They have decreased rates of ear infections. They're known to have decreased allergies or asthma later in life, obesity, type 1 diabetes. So it really is considered to be, the quote-unquote optimal source of nutrition for that newborn for all these variety of reasons.
Okay. Are there any benefits for mom?
Yeah, so there are actually multiple benefits for moms. So women who kind of exclusively breastfeed their babies have a lower risk of developing breast cancer and ovarian cancer, which is something not a lot of people, really hear about. And then also it helps with that immediate postpartum period of bonding with the baby, and it can also help with weight loss after the delivery. So there's some great benefits for mom as well.
Wonderful. So that's a great way to get us started. So I know a lot of people have concerns and questions about breastfeeding. Can a mother breastfeed if she's not feeling well? Is that okay?
Sure, I think a mom can definitely breastfeed when she's not feeling well, always being mindful of how she's feeling. If she has a fever of 104 and she's shaking, then that may not be the optimal setting in which to breastfeed a child, but an illness per se does not make her incapable or unable to feed her child. Okay. But I think being mindful of taking care of yourself, staying hydrated is really important, especially when you get sick and you have high fevers or you have some sort of nausea, vomiting, diarrhea, something like that, where you can get dehydrated, it will drop your supply. So it's definitely not a contraindication, as we say, to breastfeeding, but just always being mindful of taking care of yourself as well, because you have to feel well to be able to produce milk and feed a baby.
Okay, producing milk, that's obviously a question you get a lot. How often should a mom be feeding her baby, or is there an optimum time? Can you take that one?
So about every 2 to 3 hours is what we tell moms to feed their babies. And a lot of times babies will also, let you know when they're hungry. But in general, about every 2 to 3 hours.
Okay. So every 2 to 3 hours. And then what are some of the common hurdles that you hear about starting breastfeeding? I breastfed my children, and lots of friends did.
Yeah.
It seemed like that first couple weeks was the hardest.
Yeah, I think the first couple weeks tend to be the hardest. You're juggling a lot. One, whether you're a new mom or it's your second or third child, there's a transition period those first few weeks. Adapting to having a newborn at home, you're not sleeping a lot. You are still having to do your regular things like laundry and cooking and cleaning the house and finding time to take a shower yourself. So I think the first few weeks, the biggest struggle that a lot of people have is just finding time to do everything, and then you have a baby that's going to eat every 2 to 3 hours and isn't feeding itself. So I think one of the most important things I tell a lot of patients is relax, take as much help as you possibly can. Use, if family members are around or friends, if someone else is able to do cooking or someone else is able to do the laundry, by all means let them do it, because no one else can breastfeed that child, but they can help you do those other things around the house. And I think taking some of that other work off of your plate also helps you relax a little bit, which is stress is one of the biggest killers of breast milk supply. Is that when a mom is stressed out, she's not going to make as much breast milk. And so I think if she can relax by letting go of some of that other workload that she's feeling, it can help not just with bonding with the baby, making sure supply. Sometimes the latch becomes a little bit easier. The baby is more comfortable in arms that are a little bit more relaxed.
Okay. And it's also important to know that just because you're having difficulty with breastfeeding is very common. It doesn't mean you're not doing it right or you're a bad mom. I remember, as an OBGYN resident, one of my really good friends, also in residency, had a baby. She was like, this is the hardest thing I have ever done. I thought I just put baby onto my breast and magically it would happen.
Yeah.
So it's very common to experience difficulty, and don't be shy about reaching out to your doctor, your lactation consultant about getting some help with breastfeeding.
Very good point. So we started getting some questions in from our audience. So we have one here from Sushama. And this is a question that I had years ago. Will exercising or getting tired decrease milk production? You take that one?
So no, exercising doesn't decrease your milk production, and actually in the postpartum period, exercising can be a good method of stress relief. So of course, if you feel tired, you may not be in the mood to breastfeed, but those don't in themselves decrease your milk production.
Mm-hmm. So what are ways to, since that doesn't decrease, what are ways to increase your milk production? Are there foods or are there habits that a mom could do?
Yeah, as far as foods, oatmeal is commonly used to increase breast milk supply. There's a variety of different products out there like mother's milk teas or mother's cookies. One of the biggest common ingredients amongst all of those is fenugreek, actually. And fenugreek is a natural herb that is known to increase breast milk production. And if you go look at any of these cookies or teas, that's really the common ingredient amongst them all. Some simple tips I tell some patients is you can actually get just a bag of fenugreek seeds at either any Asian market or like an Indian grocery store, even Whole Foods. Any of these grocery stores will have fenugreek, and you can just make a tea out of that and just drink a glass of that every day, and that will increase your milk supply.
Is it really effective?
It was for me, and I have a lot of patients who feel that's been effective for them as well.
Okay. Are there other foods or herbs like that you found to be effective that patients have told you about?
Well, not necessarily foods or herbs, but staying well hydrated, because your breast milk, if you think about it, that's a lot of water that baby's taking out of you. So if you're dehydrated, then your milk supply may not be up to what your baby needs. So drinking lots of water.
So lots of water. What about caffeine? How does that impact breast milk? I know they say not to drink, obviously, a Red Bull, but is it okay to have a cup of coffee, a cup of tea?
Yeah, absolutely. There's no doubt I suggest that you can't have a cup of coffee or a soda when you're breastfeeding. I think similar to other foods in general, you just have to see how your baby reacts. Some women feel like their babies are sensitive to caffeine and that their babies act differently on days that they drink coffee versus days that they don't. So I would say follow the cues of your baby and see how your baby acts, but there's definitely no reason to suggest that you can't have a cup of coffee or a soda.
Okay, good to know. So here's a question we have from Carter. And her question is, can you pass an illness onto your child through breastfeeding? Does that happen?
So there are very rare illnesses that you can actually pass on to your child while breastfeeding. For example, HIV is one of the classic examples. But most illnesses cannot be passed to your child. So with most illnesses that you have, you're actually safe to continue to breastfeed because babies are getting lots of, kind of like Dr. Patel said, lots of antibodies and benefits from the breast milk. So of course, if you're ever concerned, you can always talk to your provider, either your obstetrician or your midwife, about if you have concerns about a certain illness. But most of them don't get passed on.
Okay, good to know. So keep these questions coming. We're almost halfway into our chat already, so keep asking in the comment section. We've got a second one here that I just lost it. This is another one from Sushama, and she asked, how many ounces of milk does new mom produce, and does this plateau over time or increase with the demand of your baby? I thought that was an interesting question.
That is an interesting question. There really is no what is every mom produce or what's kind of normal. You'll hear a lot of varying stories. There are women who are what people call overproducers, who produce way more milk than their child will ever need, and there are some that will only produce 10 ounces in a day or even less. So every woman kind of has her normal amount that she produces. What's important is watching that your child is getting enough intake, whether it's from breast milk or supplementing if you have to. That's what's really important, but there's not necessarily a really normal standard.
Yeah.
And in the first, couple of days after of the baby's life, it's very common for a lot of women to supplement with formula because they feel like they're not producing enough.
Mm-hmm.
But in those first 24 hours, the baby's stomach's about this small, so you only need about 5 ounces with each feeding. So, and if you think about 5 ounces is really not much. So most times babies are getting enough. And in the first, couple of days, it's that nutrient-rich colostrum, which the babies are getting. So as long as you're watching for signs that your baby's not dehydrated or it looks like it continues to be hungry, you're most likely producing enough milk.
Okay, and with that, signs that your baby is hungry, what is that usually? How would a mom know that my baby is hungry?
So babies will, maybe they can't make it the full 2 to 3 hours for feedings. They will cry, or when you feel like they're done feeding in that session, they might soon, 10 or 15 minutes later, start crying again or be inconsolable. Those are kind of signs of hunger. Also, you want to look at wet diapers. Wet diapers is a good mark that they're getting enough intake, as well as soiled diapers, bowel movements. And that's really a good measure that pediatricians use, is wet and soiled diapers as a marker that the baby is getting enough intake.
So one of the questions we got ahead of the chat, that a mom said, physical reasons she's not able to breastfeed. What are options for moms that just can't for whatever reason?
So one option is getting donor milk. So donor milk comes from other moms who are, maybe some of them are overproducers, like Dr. Patel said, who have produced a lot. And donor milk is screened for, kind of common infections. So we consider donor milk to be pretty safe for your baby. So your baby gets that benefit of getting the antibodies and the nutrition of breast milk if you are unable to breastfeed.
And I think one of the other things to consider is if it's actually the act of breastfeeding where maybe your baby isn't able to latch well, then there's pumping is also an option. And a lot of women will do exclusive pumping rather than breastfeeding per se. And that is essentially still providing your child with that same breast milk just through a bottle, and you just pump instead of actually bringing your child to the breast.
Okay. So if you're pumping, do you have to pump the same time increments you would as if you were breastfeeding?
Right, so pumping really is at the same time increments that you would for breastfeeding, because the way breast milk is produced is all based on demand. So if your baby feeds every 2 to 3 hours, that's an indicator to your body to produce breast milk about that frequency, because that's the demand of the baby. So similarly, the pump is acting like the stimulator on your breast. So if you pump regularly every 2 to 3 hours, you will continue to make milk at that regular interval and be able to provide for your baby.
Perfect, great question. So here's one from Carter. Should you wake up your baby to eat? What do you think about that?
So yes, definitely in the first couple of weeks of baby's life, babies need to be eating every 2 to 3 hours. So you shouldn't let the baby kind of sleep all through the night, even though they don't wake up hungry. You definitely need to feed them every 2 to 3 hours.
That's why moms are so exhausted.
Exactly.
Right. Yes.
Okay, so different question, so different plane. Lots of women, we work outside the home, we have to do things, lots of women breastfeeding in public.
Yeah.
What tips do you have for moms who are going to do that?
Several tips for breastfeeding in public. So it's legal in 50 states now, so yay for that. So for breastfeeding in public, one of the common things we tell people, for example, you can practice at home, because some people feel very uncomfortable about how they would navigate, putting the baby on the breast in public.
Right.
So practicing at home, for example, in front of a mirror. If you feel like you want some modesty in public, having a cover up with you. So that can either be by putting a loose shirt over what you're wearing, or wearing a lactation bra that gives the baby easy access to the breast.
Okay. So I feel like some women feel that when they cover the baby up, the baby's going to suffocate. That's not going to happen.
No, babies are fine.
Yeah.
Very resilient.
Perfect. All right. So I know that was one common question. So how do you know that your baby has latched on correctly? What should a mom look for?
So one, if the latch is correct, it really shouldn't be painful. Usually the most common sign of pain with breastfeeding is a baby that has not latched on correctly. And you want to make sure that they're using really their full mouth, and it's encompassing the full area of the areola, and that the suck is really a deep suck. And that they are really emptying the breast. With an appropriate latch, they really should be able to empty that whole breast. It should be a deep suck. those and not painful.
Okay. Do you want to add anything?
No, just like Dr. Patel said, pain is often a sign that babies are not latching properly. Okay. So reaching out to your doctor or midwife who can refer you to either a lactation consultant, a nurse, someone to help coach you through proper latching.
Okay, good to know. So I assume, when my children were done eating, they stopped eating. Are there other things, should you stop your baby from eating if you're breastfeeding and say, yeah, that's enough?
Babies, I don't think will ever overfeed themselves. Yep. So they are good at knowing when they're done and they're full, and so you don't actually have to stop your baby. Your baby will naturally come off, will stop when they are full. Some babies will sometimes use the breast as a pacifier, so that you do have to watch out for that. But as far as if there is still milk coming down and they are full, they will release themselves if they are full. Gotcha. I think the area of concern more is that if they've completely emptied the breast and now they're using you as a pacifier rather than for the source of their breast milk.
Yes, I've seen that happen before. It's like, oh, I'm just going to stay here.
That's right.
Okay, so does a mother, and I'm going to start with you for this one, does a mother have to drastically change her diet to breastfeed, or should she continue eating what she's always eaten?
No, so she doesn't have to drastically change her diet to breastfeed. In general, we recommend a healthy diet, so eating, reducing your amount of refined sugars, reducing simple carbs, and just eating a healthy, well-balanced diet that has appropriate amounts of proteins, vegetables, and complex carbs. And apart from that, you don't really need to change your diet to breastfeed.
Are there certain maybe vitamins and minerals that you want to make sure that you're getting when you're breastfeeding?
So in general, we tell you to continue your prenatal vitamins that you've been taking during the pregnancy. Right. And like Dr. Patel said, the fenugreek, if you're having troubles with supply, how much you're producing. But otherwise, no other special kinds of vitamins.
Okay, good to know. So here we have a question from Nimoshika. I apologize if I mispronounced her name. And her question is, does the breast milk supply remain the same for the second baby as for the first baby?
That's a really good question. I think a lot of moms anticipate that one pregnancy is going to be like the next and that one baby is going to breastfeed like the next. And just like every pregnancy is dramatically different, the same can be for breastfeeding. It is, there's a lot of things that factor into breast milk supply. One is, as we talked about already, mom's her mental health, her physical health, stress, how relaxed she is, and then also your baby. It's the demand. It's a supply and demand situation with breast milk. And so, if your baby is demanding more, your body usually will be able to keep up and produce more breast milk. If your baby's demand is not the same, it may not be the same. So you may not produce the same amount pregnancy to pregnancy, and it's just because there are a multitude of factors that go into breast milk supply.
Gotcha. Okay, good to know. So we've got a couple more. We've got room for maybe 5 more questions. We've got a little more than 5 minutes left, so keep them coming. Want to definitely also thank Parkland Hospital. Parkland helped promote this chat, and they deliver a lot of babies over there, so we're very excited to have them in on this. One of the other questions we got in was, what is the difference between breast milk and formula? Like, are there just different obviously formulas has benefits. How do you explain that to your patients?
I'd say one of the reasons so there have been many studies to kind of look at infants who are formula fed and versus infants who have been breastfed. And that's how we came up with noticing this trend of decreasing the risk of childhood obesity, decreasing the risk of diabetes, and decreased incidence of infections. One of the reasons we think that is because breast milk has babies getting a lot of benefit from mother's own antibodies, which formula it's fortified with supplements and nutrients that you need, but they can't artificially give you the antibodies that mother passes to the baby.
Gotcha. Okay. So I know we've talked a lot about the positives. There are great benefits to both the mother and the baby for breastfeeding. Are there any negatives? Are there things that new moms should think about?
Yeah, I think that one of the things that we touched on earlier is that everyone makes it sound like it's no big deal. Just breastfeed your baby. And it definitely, there is a learning curve with it. It can be stressful. It can be difficult. And so I think that is one thing that everyone really should kind of understand and really take to heart is that it's not going to be easy, and that's okay if you know, to have those hurdles and those struggles and kind of reach out. So that I think can be a negative for a lot of patients, is that it's not as easy as it's sometimes portrayed to be, and that can be challenging.
Yeah, you don't just attach the baby.
Right, and the baby doesn't just know what to do exactly, and you don't know exactly how perfectly to hold the baby in your arm and the breast, and trying to drink a glass of water and fold laundry at the same time, right? And I think the other challenge that we talked about is being in public. Is that, you know, is that some women do feel like if I'm breastfeeding, I'm kind of tied to my baby all day long, because that baby has to be fed every 2 to 3 hours, and that can be difficult for a lot of women, and understandably so.
And I think also in the age of social media, where there's a lot of kind of mom guilt going around with, so people feel like, you know, I will do this, if it kills me, I will, you know, and feeling that burden of guilt if you are having difficulty or if you're not successful breastfeeding, but knowing that, you know, you're still your mother's baby, your baby's mother, I mean, and, you know, your baby won't love you any differently because of some difficulty if you're unable to, but so just trying to keep everything in perspective. Yes, we definitely think, you know, breast milk is best for the baby and everyone should try to breastfeed, but not to the detriment of your mental health.
That brings up a good point. There are definitely lots of people that are out there that are talking about breastfeeding online, and they're sharing photos, and it does, at least I've experienced, some women do feel upset when they can't breastfeed, but it sounds like, you know, moms need to figure out what works best for them.
Exactly.
And if they have challenges, then reach out.
Absolutely.
What are some of those resources that moms could take advantage of?
I think the biggest resource is really your doctor, and going to your doctor and your pediatrician. Pediatricians' offices are tremendous resources in this avenue. Finding a lactation specialist, either through your obstetrician or through your pediatrician. And a lot of hospitals have lactation services on site. And so really using those lactation services for the days that you're in the hospital, and letting them help you and be comfortable, so that hopefully you hit the ground running before you even leave the hospital.
And if you're at a hospital that has lactation services, you can use it for every baby. You don't have to feel like, I use it for the first one, I can't call them again.
Correct, yes.
Exactly.
Like, you know, like we kind of said, every pregnancy is different, every experience breastfeeding is different. So yes, just because you're a third-time mom doesn't mean that you're, you know, should be ashamed of needing to have support from the lactation services, not at all.
Yeah, good to know. All right, one other popular question, then we're gonna have to close out in a couple minutes so you two can get back to your days. Can a mom drink alcohol while breastfeeding?
Yes. So, in general, it's recommended. Well, the American Academy of Pediatrics says that you can have moderate amount of alcohol while breastfeeding. So, general rules to follow is, if you're feeling buzzed, then your breast milk is going to still have a lot of alcohol. So how you're feeling is going to translate to likely how baby's feeling. So breastfeeding while drunk or buzzed, you should wait. And they recommend about waiting 2 hours after for one drink. So if you have 4 drinks, which you probably shouldn't be having that much at that point in one go, so that would be 8 hours. So just making sure you're aware of how much you're drinking and gauging that, because alcohol is passed into your breast milk.
I've heard some moms or heard some physicians recommend, you know, if you're going to drink, you know, more than a glass of wine, then you could always pump it and kind of dump it. It seems like you're in some ways losing gold though. I mean, is that a viable option? Does that work?
It is, and I think the reason, you know, to consider that is not just because you don't want to actually give that breast milk to the baby, but if you wait that many hours without relieving your breast, one, it will become painful for the mother, but two, remember, it kind of goes back to that supply and demand. If you've now spaced out to 6 hours between an episode of emptying your breast, it kind of signals to your body that maybe the baby's not feeding as frequently. And if those occurrences happen more frequently, your natural supply will drop. And so that's the other reason to consider to do that really pump and dump, is really to continue to ask your body to continue producing milk, but you're not going to be able to give that milk to your baby, so you have to dump it.
Okay. Good to know. So we've got time for one last question. I want to thank everybody for tuning in. These really great questions so far. So last one, and this one came through before the chat too. New mom, she's about to return to work. You know, she's been able to breastfeed for 3 months. Now she has to go back into the workforce. What do you recommend for that mom?
I mean, I think the biggest thing is do what's best for you, your baby, and your family. It kind of goes back to what is going to be best for your mental health. Going back to work after having a baby and being home is really can be traumatic to some moms and is a big lifestyle change for everyone involved. And so some moms, you know, it can be stressful enough that their milk supply drops and then but they wanted to pump and now they can't because they're stressed. So I think balance is the best word here. Keep everyone's mental health and physical health in balance, but I think pumping is a really great option. If you are committed to continuing to breastfeed and you're able to do so, then pumping at work every 3 hours, you know, to maintain your supply is great. Now, that's not feasible all the time, but basically pumping as frequently as you can at about every 3 hours is, I think, the best.
Okay.
And also after feeding your baby at home, doing some pumping afterwards so that you can save that milk in the freezer so that when you're not there where you're at work, someone else can give your baby your breast milk.
I think that's all the time we have, ladies. All right. Well, we want to thank everybody for tuning in to today's chat. As usual, the chat will be available here on our Facebook page, and we'll also be loading it to our YouTube channel later this afternoon. So if you have friends that are on Facebook, please direct them that way. And in the meantime, I want to thank our guests, our doctors, for joining us. Thank you both for your time.
Thanks for having us.
Thanks for having us.
Absolutely. And stay tuned for more information about World Breastfeeding Week. And I hope you all have a wonderful day. Thank you.